Hello everyone. So this is Dr. Spinach and today we are going to be talking about the structure of the bone. Now, if you remember in our previous videos, we already talked about the introduction to orthopedics as well as histology of the bone, right? So today we are going to be looking at the structure of the bone. And in the next video, which is coming up very soon, we're going to study about the physiology of the bone. Now, before I begin and before I move further, let me tell you one important thing. Now, all of that, what I'm teaching right now, right here, is very high yield for NEET-PG examinations, Fmge examinations, as well as Usmle examinations, okay? And the next thing is, of course, I've not mentioned PLAB here because PLAB usually asks clinical questions rather than basic questions. But it is always good to remember or to understand what is the basics of a subject, right? What are the basics of the subject? So without further ado, let's start. So we are going to take a typical example of a long bone, okay? Any long bone in your body. So what are long bones? The bones like humerus, like radius, ulna, femur, all of these are long bones. So what do they have in common? Well, we are going to start with epiphysis. So they have three parts, that is epiphysis, metaphysis and diaphysis. Now epiphysis is the head part, metaphysis is kind of the neck part, and diaphysis is the shaft part. Right? Now these bones are covered by a structure called as periosteum. What are these covered by? Periosteum. Now periosteum is actually attached to this bone by some fibers that are called as Sharpie's fibers. Okay, Sharpie's fibers. So Sharpie's fibers actually help periosteum attach to the bone. Okay, now we're going to look at each and every of these parts of the bone in details. Now let's start with diaphysis. Okay, so we have zoomed in the diaphysis here. Okay, so let's start by looking at what are the parts here. Now, if you see here this green part, okay, so black one is the bone. Now, what is this green part that surrounds the bone? This is periosteum, right? This is periosteum. And now you have diaphysis here. The middle part in the periosteum is the medullary cavity. So you can also say it is a bone marrow, right? Now there is this blue color sheath or blue color part that surrounds this bone marrow, and that is known as endosteum. What is it known as? Endosteum. So what are the parts here? So the bone is surrounded by periosteum. Peri means around, osteum means bone. So around the bone, what do we have? We have periosteum. Around the bone marrow, what do we have? We have endosteum. Now you can also find that you have these blood vessels that are actually around this bone, and they're actually going inside as well, and supplying to the inner part of the bones, right? So what are these known as? These are known as nutrient blood vessels. These are known as nutrient blood vessels. Well, they have some of the nutrient foramina or blood vessels foraminas here, which allow them to go inside the bone as well. Okay, now let's look at the function of periosteum first. Okay, so what are the functions of periosteum? The first one is that it provides what? Nutrition. It provides the nutrition to the bone. And the second one is that what? It actually helps in growth of the bone. Now, how does it help in growth of the bone? So you can see periosteum is around the bone, right? Now, when periosteum stretches, it will help in increasing the width of the bone, that is the thickness of the bone. Now what is this known as? This type of growth where the thickness of the bone is increased, this is known as appositional growth. So remember, this is known as appositional growth. Okay, so what have we seen? We have seen diaphysis, which is basically the shaft, and which has bone marrow, right? Which has bone marrow. Now let's go and look at the metaphysis. Okay, So what is the speciality of metaphysis? Well, the speciality of metaphysis is that there are like too many blood vessels which are arranged in a hairpin loop arrangement in metaphysis. So the question is, what is good about this arrangement and what is bad about this arrangement? Now, if there are too many blood vessels at a location, what is good about it? Now, if there is a fracture or an injury, then due to increase in vasculature or vascular blood supply, this will lead to, this will help in healing. This will help in healing. Okay, so the healing will be fast at this location, right? Now, what is bad about it? What is bad about it is if there is too much of blood supply here, then this would be the structure that will be involved with increased bug inoculation. I mean, bug proliferation. That means increased infection, right? So there will be increased infection rate in this area in the metaphysis, right? Now let's move on to the epiphysis. Now remember, back here we have completed diaphysis. What are the locations? What are the things that are inside the diaphysis? We have seen metaphysis, so we'll move on to the epiphysis. Okay, so epiphysis. Now let me zoom in. Now, which one of these is child's and which one of these is adult's epiphysis out of two? Okay, again, look at this. Which one of these is child's and which one of these is adults? Okay, now if you have decided, let's move forward with the answers. Now, if you see here, in this case, in this area, you have what? What is this here? What is this? This is epiphyseal, physeal plate. What is this known as? It is known as physeal plate. Now, what is the function of physeal plate? It actually helps in lengthening of bone. So if you remember, which helps in thickness of the bone, that is periosteum. What helps in lengthening of the bone? Physeal plate. So who will have lengthening of bone? An adult or a child? A child. So when you do the x-rays of child and adults, you will see that physeal plate is present in a child and physeal plate is absent in an adult, right? So this is adult and this is child's. Now we also saw that when there's a thickness increase of the bone, which we call as appositional growth. Now when there is increase in length of the bone, what do we call it as? We call it as interosteal growth. We call it as interosteal growth. Okay, so there are questions that arise from physeal plate as well. So what are the 5 layers of physeal plate? Well, I've already told you that there are 5 layers. So what are these layers of physeal plate? So we have to know these layers. The first layer is what? The germinal layer. What is it called as? Germinal layer. Okay, then another one is what? Proliferative layer. What is it? Proliferative layer. And then we have hypertrophic layer. Next, we have calcification layer. And finally, we have ossification layer. Okay, so these are the 5 layers of physeal plate. Okay, now does anyone of you know that how will the growth take place? So the growth will take place from germinal to ossification layer. Of course, growth will not take place from ossification, then calcification, then hypertrophy. So first there will be germinal layer, which will then proliferate, which will then hypertrophy, which will then calcify and finally become ossified, right? Now germinal layer is present towards the epiphysis and ossification layer is present towards the metaphysis. So what is the direction of growth here? From germinal to ossification, right? From germinal to ossification. So the direction of growth, if you see here, this is epiphysis and this is metaphysis. So the direction of growth in this case would be from epiphysis to metaphysis. Okay, so all of these are questions that have been asked in previous examinations, and this also actually completes the structure of bone. Not much, isn't it? So remember, there are 3 parts, that is epiphysis, metaphysis, and diaphysis. Then it is covered by periosteum, which has sharpies fibers. Periosteum is a fibrous sheath which actually helps in growth of the bone as well as provide the nutrition to the bone. So we have seen everything here. Okay, appositional growth, what is it? And finally interosteal growth, what is it? And what are the layers of the physial plate? So that concludes the session on structure of bone. Please make notes, and well, I'll see you in the next video, which would be about the physiology of the bone. So stay tuned, subscribe, and hit that notification bell. Bye bye, take care, Dr. Spinach.